Hi Foot Geeks fans, it's CJ again with Heather from Divine Elements, and today we want to talk about Hallux Rigidus and how naturopathy can help relieve discomfort from that.
So Hallux rigidus is usually a disorder of the base of the big toe, and it causes a lot of, it's not able to actually move through it, and it almost gets stuck. So in naturopathic medicine, we're always looking at trying to treat the root cause and treat the person as a whole. And with that, I'm looking at what their diet's like, what their activity level's like, any trauma, again, that they've had to that area.
Yeah.
And sometimes it comes down to actually just doing a physical adjustment and actually just trying to get into that joint and move it around, even if it can be uncomfortable, especially if it's kind of been locked.
Yeah.
Or kind of stuck.
So do you find it's mostly a result of turf toe?
So yeah, especially if there is any type of jarring, and it kind of just pushes the distal part or the toe part towards the base and just kind of locks up that joint.
Yeah.
So we can do adjustments for that. Sometimes just massage soft tissue, just mobilization and moving the toe around.
Yeah.
Just getting it outside of that zone of what you're able to do just on your own with bending your toes, and just try to bring a little bit more movement. A lot of heat is great for it to just bring that circulation.
Yeah.
And acupuncture is great for it. And then if needed, we can always go to what's called prolotherapy, which is an injection in this case, into the joint. It can also be into ligaments and tendons around the joint, in anywhere of the body. And in this case, going into the joint and adding a little bit of a dextrose or sugar solution, as well as an anesthetic like Procaine. What that does is it helps to bring a little bit of inflammation to the area, which then triggers the body to bring its own healing cells. So we're looking at platelets or white blood cells that help to just fight and help to bring more cells to the area to help it heal.
To help it heal. Okay.
It also helps with that little bit of anesthetic to just take out that pain, so we're not always getting that pain response right back to the brain.
Yeah.
And then patients realize that with that injection, sometimes that pain does go away, even if it is just for a couple hours, and in that time we can do a lot more mobilization because they're not feeling that same pain sensation.
Okay, so you can basically, the mobilization that you were talking about earlier, if you put prolotherapy with anesthetics in there, it allows you to move the toe joint probably further so that the client doesn't have pain from it.
Absolutely, and they're able to, and because the body is then triggered that there is an injury there, then it's able to bring in more cells to help fight that. Sometimes if we have a chronic injury, the body almost forgets that area is injured, and it stops bringing those helpful cells to the area to help heal. So we're just triggering the body to say, hey, this is still injured, we need some help in this area, and to bring more blood and circulation.
Okay. And then with regards, is there any particular points in time when you wouldn't want to use prolotherapy or something like that to treat Hallux rigidus?
It would be one of the last resorts I'd use. I would try the adjustments, I would try the massage. I'd be looking at a bunch of other options before I'd go to that. But really it is all patient dependent, and I do like to treat each individual how it's best for them.
Okay. So if you have any other questions regarding prolotherapy or Hallux rigidus for Dr. Heather van der Geest, please post those below. And if you haven't subscribed yet to us on YouTube, do so right over there.